The excitement starts when you hear the great news. You're having a baby. But now it's time to focus on you and your baby and keeping you both healthy. Dr. Jill can fill us in on some pregnancy no-nos, and more importantly, why are they even no-nos?
Indeed.
Yeah, okay, so let's first talk about why. There's a whole slew of things that you're told when you get pregnant. You can't have this, you can't have this. Why? What is the difference now?
Well, now, after years of experience, we know that those certain things can have bad effects on the baby or the mother.
Right, but some of those things our parents did, and they said, oh, it was fine. You turned out fine. Look, you look okay.
A good example of that would be having the baby sleep face down.
Right.
I slept face down for years and nothing happened, but later on proved that it actually is bad to sleep face down.
Okay, so let's go through some of these things. First of all, let's talk about alcohol, which is pretty self-explanatory, but alcohol and cigarettes. Some people in different countries have a glass of wine a day, even when they're pregnant. We are told in the United States, no, completely stay away from it. Why?
Well, the main reason is fetal alcohol syndrome, and it can affect the baby. We actually don't know exactly how much alcohol can do that, so that's why we just say really hold off on it. And we know we actually used to use alcohol to stop labor. And we would inject moms with alcohol to kind of get their uterus to quiet down.
Really?
And then obviously we found this association with fetal alcohol syndrome and we stopped.
Okay, but is one glass of alcohol every once in a while, once a month, okay? We're talking a glass of wine or something?
I would never tell someone to go have a glass of wine, but I think if someone told me that they had one, I'd probably offer them some reassurance. It's probably not going to do that much harm.
All right, but try to abstain if you can.
Try to abstain.
And cigarettes?
Cigarettes are interesting. Obviously, we know cigarettes hurt the mother terribly. It can lead to lung cancer and all the bad effects. But for babies, it actually has a direct effect. I mean, when you take an inhale, basically the vessels in your body kind of spasm a little bit. And so the blood flow that goes to the baby can be compromised. So babies that have smoking moms they can be a little jitterier after they're born. They can be smaller, so growth is a big issue.
Okay.
So it really does some direct harm to babies to smoke.
Okay, so absolutely stay away from smoking.
I encourage them to please stop.
Let's go to something a little bit more subtle. We hear caffeine.
Yes.
Caffeine, stay away from.
Right.
Can you have a cup of coffee a day when you're pregnant?
I tell my patients it's fairly safe to have a cup of coffee every day during pregnancy.
Just don't drink a pot.
Just don't drink an entire pot. Have a little bit of caffeine if that's what you feel that you need. Because sometimes if you withdraw from it, you can get headaches and other bad things. So again, I wouldn't advocate drinking it, but if you need it, I don't think it's going to be too terrible.
And what kind of effect will it have on a child, a baby?
Well, actually, caffeine raises your blood pressure. So again, as you raise your blood pressure, the blood flow to the baby is a little bit compromised. So that's why high blood pressure in pregnancy can be so dangerous.
Okay.
So, and caffeine can attribute it to that.
All right. What about unpasteurized cheese? We're told to stay away from some fromage if it's not pasteurized.
Exactly. And that's related to a bug called Listeria. Okay. But I will tell you, in my experience in the last 12 years of practicing medicine, I have yet to see one case of Listeria.
Really?
I still would tell people, please stay away from the soft cheeses, but every once in a while, again, it probably is not too bad. It's a rare thing.
Okay, and finally, we don't have to completely abstain from exercising. It would actually be good to work out, to keep ourselves in shape, but just nothing too intense, correct?
Right. I think whatever you were doing before you were pregnant, you should continue to do while you were pregnant. Exercise is the best thing for you. Just make sure your heart rate doesn't go above 120. Okay. Then you know you're not compromising the baby.
So wear a heart rate monitor at all times when you're exercising and you're pregnant. Dr. Jill, always a pleasure to have you here.
Thank you
so much. All right, we'll be right back. Don't go anywhere.